What safety protocols do you have in place for when staff and students return to the buildings? What protocols are in place should someone become sick with COVID?
So safety protocols are essential as we move forward into this new world, especially the new world of COVID. I think we're really doing due diligence with following what the county health guidelines and working with our county health officials as far as keeping just up to speed with their requirements and what they're identifying as potential concern areas. We've shared our restart plan with our county health official, and we're working with him on a number of things just to kind of help keep the building safe for staff and for students who may come in or may return at any point. As we kind of look at our protocols and systems, we're not only are we connecting with the county health officials, but we're also connecting with LNI, and we're connecting with the CDC and the State Board of Health. And so what's interesting about that is everybody has a little different take on what those procedures are and what those safety procedures might look like. And we're being very diligent about following our county's recommendations and staying in alignment there. We're also coordinating with the other island school districts and making sure that we're all on the same page as far as what we're doing as far as delivery models and safety procedures.
First of all, we're guided by a document that was released by OSPI, and we have to do it in coordination with our own local health department, the governor's Safe Start Plan, LNI, and CDC. So there are a lot of documents that we have to bring together to kind of figure out what we will do when people come on campus. Well, when it comes to testing, we do not. There's no mandate that we would test students or teachers when they to come to campus. Not initially. What we have created. Let's talk about the remote model first. Teachers are not mandated to work from campus. Several do just because they our internet connectivity is so strong, it's easier for them to work from their desk. I'd say several, maybe 50% of the staff will work from their rooms. They only go to their rooms. They don't go anywhere else on campus. And I think one of the things that is key here is that I have to stand for staff as well as for students, and we have a lot of high-risk staff here, and we don't want to put them in a position where they could contract this disease. Now, that being said, we have safety protocols that are in place, and for example, we did run a summer school program in the middle school that had 4 students in each section, and we had 8 students total. And when they arrived, there is a process of health questioning, health screening. Temperature is taken. When they go to their rooms, there's a specifically assigned seat. They are mandated to wear masks, and they are socially distant. We measured out the rooms. For example, if we bring in 50% of the population of students, we can fit students in about 95% of the rooms and be 6 feet or more apart from each other. So there were a couple rooms we may have to move that class to a bigger facility, maybe the gym or our commons area. But what we have are a set of protocols when someone comes in. We have a set of protocols if someone gets sick, and even if it's not COVID, they automatically have to go home, and they have to go through the test. They have to go through quarantine, and we limit their movement on the facility so that we can contract trace. When a teacher comes into work at in the school building, they identify that they are in the building, so we know, and they identify where they are in the building, and then there's just no interaction. When visitors come, for example, especially the first 2 or 3 weeks, let's say at the high school, because there's a lot of traffic usually from parents at a high school, the first 2 weeks of school coming in to pay pay fees or to get material or whatever. We actually are doing everything by appointment. And we even have locked the door, and we ask them to call a specific number, and we'll come out and let them in. And eventually, when the door is unlocked, they'll see the 6 foot, just like you see in the grocery store, the 6 foot distant stamps on the ground, only so many people in the office at a time. So we've created a process for doing this. It does not include testing. And so there you go. That's what we have at this point.
In the event here at Orcas Island School District that we happen to have somebody who's been exposed to COVID or test positive to COVID, really for us, it's about working closely with Dr. Frank James, the health officer for the county. We would report that to them at that point. They would take over the contact tracing. Again, everything that we've set up keeps students and staff into cohort groups. That's critical for us, so that if we do have a positive case here, we may need to self-quarantine a cohort group, but as a school district, we can continue to offer services going forward. So that's a priority for us, and that's part of the planning that's been done all summer and has been a common thread through everything we've done, whether that's the in-person model or even the distance learning plus model that we're establishing. At that point, we have a really close relationship with Dr. James and his team, and they've done an amazing job. We communicate weekly with them. We would notify our district and the community as well that we would have a positive case and the next steps that would be handled. But basically at that point, we would turn it over to them and we would follow their direction.
If we should have a student or a teacher who tests positive for COVID, whether they're asymptomatic or not, we will shut the school down and go to Zoom for 2 weeks and have an opportunity to clean the school and have anybody who's been exposed to see if anyone else comes down with COVID before we come back into the classroom. So whether that would require some testing or not, we are definitely prepared to go tell a school if we should have a positive test within our building so that everyone feels safe and an opportunity to keep the distance. So if a student should test or should begin to have any type of COVID symptoms with a fever and cough, we would probably require the students to get a COVID test before returning to school. So we would be looking for a negative test if they have had any symptoms that line up with COVID.
How many children depend upon school lunch programs and daycare? How do you plan to support them throughout the school year?
Yeah, we plan to support our students through our meals program, and one of the ways what we did this last spring was a model that was quite successful, and some of the other island school districts picked it up and used it as well. But we started a delivery model based off of the bus stops, and had a great system and set up there. We had volunteers who we would have them come in with masks and all the safety requirements needed, but we reached out to our community and received enough support there that we could navigate a healthy meals program. We average about 110 meals during the school year on average, but during the crisis, we were closer to about 150 meals first. So for us, being a small little school, and that's more than half of our school population, it was great to get to support our community that way. I think one of the challenges is daycare. We don't, being a smaller island, we don't have as many daycare options. And so that's and we don't have the staff to support daycare options. So that's definitely one of our challenges. And like I said from the beginning, we're not perfect, but at the same time, we're doing what we can to support kids. One of the pieces we've partnered with is we've created a connection with our Family Resource Center and our public library, and we are looking at supporting our families from like 1 o'clock to 4 o'clock in the afternoons when there isn't the block of learning happening for kids, with an outside, we call it open air program, where kids are outside and they're engaged in a learning environment that has activities and arts and PE type activities and movement and games. And we also created a component in there that supports homework for kids too, and the opportunity for kids to read or listen to a story, and just engage in different levels with other kids in a safe and appropriate way to do that.
So last year in the spring, what happened was the governor came out and said that we could, there was a waiver that we could provide lunches to anybody that is basically age 1 through 18. So we immediately created unitized sack lunches that were really nothing more than a peanut butter and jelly sandwich in a lot of ways, and a breakfast. And we were able to take them to different sites on the island, and families could pick them up. Initially, there were over 100 families that were doing this. I think we ended up averaging 55 meals. We're just under 40% free and reduced on this school district. I think that it might be even a little bit higher if we, at this time, if we get the paperwork out to the families, i.e. that's one of the reasons why I want a liaison as well, to connect with families in need. We're a little bit different this year. We're not allowed to, the waiver wasn't provided for us to give it to any child 1 through 18. That if a student is free and reduced, we have to identify them as free and reduced, and they can have the meals. If somebody else wants to get a lunch or breakfast, they actually have to pay for it. Our lunch program is probably, in my opinion, second to none. And I am biased because I work in this district, but I don't know too many places where you go and have ginger chicken with roasted whatever. I mean, they're pretty amazing menu. Our kids eat healthy and they eat quality food. And what our program is called Food for Thought. And what the Food for Thought program is doing this year is not sack lunches. They've already put out a menu, and they will deliver. We have the cooks themselves will deliver at 2 different sites, including with a 3rd site being a school where you can drive to. If you're free and reduced, you'll get the breakfast and the lunch. And if you want to purchase, you can do that online ahead of time and pick those up as well. And we believe people are going to, because the meals are so good, and it's going to be easy for families that are working to ensure that their kids are eating healthy by purchasing a quality unitized meal that our chef has prepared. So we're ensuring lunches to everybody in need and more. We're doing even more with that. Kudos to our staff at the food service program. Daycare is a whole nother issue. So in the spring, the governor mandated that school districts provide daycare to all essential workers and their families. And we tried to create that in the spring, but we didn't have anybody take advantage of that. The waivers came to an end, so no school district is expected to do this. Even though we weren't expected, I've tried more than you know, more than I can show, to create opportunities for daycare, and we just haven't been able to establish that yet. We have been collaborating with Family Resources. We have been connecting essential workers and other families who are in need of daycare with Family Resource Center. And we've been able to kind of be a conduit for other families that are willing to take on other children in pods. We're not sponsoring the pods, but we've directed some families to that to provide the daycare. But it's interesting enough, we haven't had a lot of people ask for the daycare that we thought we would. And when they do, we have tried to meet their need as much as possible, but we don't have the specific answer for that.
As far as supporting our students in meals for the school and for childcare, we're really going to continue on what we're doing over the summer, and we were able to refine our process over the summer. Child nutrition staff is amazing. We have that flexibility that we can package meals together for the week. We have surveyed our families, and we know the best time that they can come through and pick up that box of meals. And for Orcas Island School District, when you think about it, it's interesting that when I go off island and you talk about Orcas Island School District, everybody thinks of that $11 million home up on the hill. The reality is that a lot of our students, K through 8, we're almost at 50% free and reduced lunch. So for us, we know this is a critical piece for our families. And so we've built that over the summer. We've used it, and we're going to continue it into the fall. We will provide the week's worth of meals in one box. Families can stop by, curbside service. We will put that in your car. We will mark down your name. It's funded by category because we don't have that waiver yet to provide it to everybody free. And we will go forward and provide meals throughout the entire year. That has been a focus and a priority for Orcas Island School District, and we'll continue that. As far as childcare, really it goes back to working closely with those other organizations on the island, leveraging PTSA, who is a great connection to our families, Funhouse, Orkyla, Park and Rec. The other organizations are really stepping up, and we're very proud of them helping us through this time. And they're going to provide physical spacing, staff to cover those pods that is being developed. And we have that working relationship with those individuals then who are manning those pods. So it'll really be like having just an extension of the classroom in these other locations as they follow those cohort groups that is critical for us to maintain.
Question is, how many children depend upon school lunch programs in our school? And our school specifically does not do, we don't have a hot lunch program. And so our students bring their lunch every day. In the past, we have had the opportunity to do a hot lunch once a week from the public school. And so we have taken orders, and the kids are allowed to bring their money in to have a hot lunch once a week from the public school. So that won't be happening, at least at this point, starting the school year out. But all of our students actually bring their own lunch. If we have a student show up without a lunch, we always have food available to assist and make sure they have a snack and lunch. We have a few students who have extreme food allergies, so we always have access to food items that they can have also. So if things are brought in, we always have to be sure those kids with extreme food allergies are also being taken care of.